I mailed now, just now, ma'am.
No problem.
Please check your mail and
I will let you know, Janaka, maybe by today or tomorrow, okay? Because I'm also
okay.
very busy. So, yes, I will let you know. Anybody has any question? Pubudu, Roshane, Lumal? Okay, students, if you all don't have any questions, don't message me on WhatsApp asking for the doubts. I will not reply, okay? Because I give you all sufficient time to clear everything in the session. Because I work all 5 days and with greatest difficulty, I do these lectures also on Sundays because I'm really packed with work, okay? So make use of this time as much.
Hello, Miss Afrida.
Yes,
Sorry, I got logged out from my Teams.
no worries, Ifka. Thank you for joining. I was actually explaining to the students about your assignment. Quite well written. And
Hello.
yes, Rifka, can you hear me? Can you hear me, Rifka?
The network is not clear.
Okay. No, I was explaining to the students about your what do you call your assignment?
Hello. Yes. Yes, Miss Afrida.
Yeah, so actually very well written and in-text reference done, excellently done, and your bibliography is also very good. So any difficulties you had, Rifka, with the task?
No, I've almost completed the report for now, but I just wanted to know, like, do I have to write like this is the assignment is about this in the introduction as well?
Perfectly fine. I think you're on track. You are actually the only student who is on track now. The only student who is on track.
Okay.
Yes, so very nicely done. Continue with the body part and the conclusion part. And yes, and I think if you have any doubts, you can ask now or you can WhatsApp to me because actually I was a bit upset with other students not followed instructions. I don't know whether it is not understood or clear, but I think I really made it very, very clear. I showed everything, how to do it from starting from referencing to paraphrasing to everything. So still some students have not understood. So I'm a bit concerned and worried. So that's what I wanted to ask other students, what is their issues? What are they struggling with? So that's what I'm still on your page so that the other students can take a look how it is need to be written. Okay, so continue, Rifka. You can continue the task one. You're on track. So it's fine.
Okay, ma'am. Thank you.
Okay, you're welcome. Okay, students, 1 more minute. Any doubts? Any difficulties? Because I know other lecturers don't take so much time to go through draft and give feedback. But because I know that assignments are not easy, because English is not your first language, I understand. But there should also be some effort that needs to be put from your side, right? So last week I couldn't do the lectures, and Mr. Rishad said that some students have been concerned that I have been missing classes, right? So you all need to understand that even if I miss a lecture, I always ensure that I will cover the class. I never go without covering the class, right? So you all need to understand if a lecturer cannot do a lecture, it is always for a valid reason that the lecturer has not attended the lecture, right? And you all also need to understand no lecturer wanted to talk on behalf of you all to give extension. Okay, no lecturer wanted to give you all extension. We have a separate group, and I spoke on your behalf, saying that you all should be given extra 1 month. But it came only to give extra 14 days because I spoke on behalf. So remember, I am a very reasonable lecturer. I will be very fair, but I also need to see that respect, that understanding, and also that attention from you all, right? Anyways, I'm not tough, I'm not strict, but I can be a bit disappointed at times, okay? Because I want the best for y'all. So I want y'all to give your best too, okay? So if Rifka can do it, I know all of y'all can do it, okay? It doesn't mean that somebody is good in their English. Y'all can still do it, okay? I know there are people who struggle with English but still can do it, okay? So that's what I'm saying. If you all have any questions now, you all can ask. Please ask, or I can go to the task too, and we can continue the slides for today. I will give you all a minute. Any questions, please, you all can ask. Rivka, have you started task 2?
Yes, ma'am. I have gathered the information. I have to write the essay.
Okay, so I think task 2 deadline is I've given 28 September, but because for Miss Ganguly and Miss Chammi all got extra 14 days, I will talk to Mr. Rishad to give another 14 days for my task also. Okay, just so that you all will have sufficient time. Okay, looks like no one has any questions. I will go to the next task. Okay, so task 2 is also under the principle of health and safety for health profession. Here you will be covering the learning outcome 3 and learning outcome 4. So here you will need to understand what is risk assessment process that is related to health or social care. And then you will need to know how to review the health and safety practices, policies and procedures. So again, my advice to you all is before starting the task 2, try to take all the lectures that I have done under risk assessment into one folder. Go through all those lectures, the recording, the slides very, very well, so that you have the background knowledge of what is risk assessment, how to carry out a risk assessment, why do you need to carry out a risk assessment. And then you come and read the question. So this question has 3 parts. You have part A, part B, and part C. So the part A says you need to research the type of risk assessment which are used in health and social care settings and how you have to carry out a risk assessment. So this is another hint. So everybody understood what is part A talking about? You need to know what are the types of risk assessment in health and social care. And then you need to know how you carry out a risk assessment. That is part A. And then in part B, they are telling how you analyze to work with individuals and others to manage the potential risks and hazards, right? And then what are the examples of how you can implement the outcomes, and then how you can review of own and other practices in promoting a balanced approach to risk assessment. So let me just ask a question from you all. What is risk assessment, students? If I have to ask you all this question again, what is risk assessment? Please just quickly somebody answer so we can move on fast. What is risk assessment in health and social care? What can you all tell? Taranga or anyone can answer. What is risk assessment in health and social care, students? Students, I am doing this for y'all, not for me. Understand that. So if I ask y'all, please be fast to respond. What is risk assessment in health and social care settings, students?
Uh,
Excuse me, ma'am.
Yes. Yes, go on.
I think assessing some informations regarding about health healthcare
Mm-hmm.
and mm, uh, that's recording and keep it up.
Okay. Any other answers?
Identifying hazards
Yes, very good. Yes,
and evaluate
yes, very good. Yes, simple.
and put them put in place and measure the measure how to reduce the risk.
Correct. Identifying the hazard, measuring what are the hazards, and then categorizing them based on whether it is a severe risk, whether it's a minor risk, whether it's a major risk. Okay, good. Part B. Analysis of how to work with individuals and others to manage potential risk and hazards. What can you all include? What are the points you all can include? In part B, the first point, what can you all include?
What is the risk and hazard? What is the
Yes, yes, okay. Okay, you can talk about that. What else? Rifka, can you give me some answers, Rifka? Rahilu and Pubudu and Metni, Shehara, what about some answers? No right or wrong here. You can just give me what you all remember. I will not discuss task 2 after this because I think at this rate, I think I will be spoon feeding you all if I go on in detail about assessment, right? So this will be the last day that I will discuss. Any answers that you all can talk about it? How do you all analyze it? How do you all work with individuals? Guys, these are common sense questions. It should be in your tip of the tongue by now. We have discussed a lot. How do you all analyze it? How do you all work with individuals? How do we do it? No one has written any assessment up to standard right now. Okay? No one except Rifka. And I worry that even you can't do such a simple task as task 1. How are you going to do the task 2? That is why you all need to discuss with me. At least tell me the points. What would you all put?
With categorizing.
Yes, go on, Rifka. Categorizing what?
Yes, categorizing. Now we after knowing what a risk assessment is, to carry out the risk assessment for an individual or a group, we should know what kind of categories we need to consider.
Yes,
in carrying out a risk assessment.
Very good, very good, excellent. And can you tell me who are the individuals that we have to work with? Can you guess what are the individuals? Who are the individuals that we have to work with in risk assessment? Can you give me some examples?
Can we take a staff, a person? No.
You can take the staff. So for example, let's say if you're working in a COVID hospital, what are the precautions that you need to take for yourself and for other people? And if you are getting children coming to this hospital, if you are getting old people coming to this hospital, if you are getting patients with comorbidities who are like heart patients, stroke patients, who are like having severe, let's say, highly old people, what are the precautions that you need to take so that they are not going to be in danger, right? You need to think. Every single thing has been discussed in my slides. And I cannot see anyone remembering it. You need to remember these things. Okay, you don't have exams, but at least your interaction should come fast because we have done this before, right? Okay, examples of how to implement the outcomes of the risk assessment. How can you implement outcomes of risk assessment? What are the examples? Can you guess? I'm explaining these to you all so you all will be in the right track when you write the assignment, So I know questions is not easy to understand. That is why I'm making it simplified to you all to know. I'm making all to explain the question so you can understand what to write. How to implement outcomes of the risk assessment. Taranga, can you tell me examples? How to implement the outcomes of the risk assessment? Do you all remember I told you all like last time, let's say go on.
Evaluate the Risk assessment.
Okay, good. Evaluate. That is, you evaluate before or after you implement certain rules. Evaluate after or before. What do you
Sorry?
think? Do you evaluate before or after? When do you evaluate? When would you evaluate? Tharanga, when would you evaluate? So I told you all last time, let's say when you have COVID, the first outbreak, okay, people had no mask, people had no personal protective equipments, and you can see the cases are going up and up and up. And all of a sudden, you will implement certain measures and rules and regulation, like making mask mandatory, making alcohol sanitation compulsory, and then you evaluate, okay, compare before and after. Now you can see death rate is going down, people are getting less infected, people are getting less exposed. So you need to know to evaluate before and after implementing certain rules and regulations. Okay, that's what they're trying to tell. Okay. The last one is a review of an own and others' practices in promoting a balanced approach to risk assessment. Anything that you all can tell here?
Like is it like even in an employee perspective also we can tell this, right?
Very good. Very good.
Yes. So first you have to take care of your health and safety to make sure that others are not at risk and that you can avoid them in getting into a risk, employees and other visitors or patients who are coming into the health care sector.
Excellent, Rifka. Thank you. Thank you so much. Students who are not responding, what is it? Is it what? Just openly tell me what are your difficulties? What is the difficulty in task 2? What is the issue that you all are having? Have you all submitted Miss Ganguly's assignments? Rifka, have you all submitted Miss Ganguly's assignment? I think deadline was 7 September. All done? Or you all got a deadline to?
Miss 21st. Na?
Right, right. Okay, so everybody, how did that assignment go? All clear? Because if you all are giving me in-text reference like this, giving, the copy pasting the link, I hope you all have not done the referencing like that to her assignments, right? If you all have done the same mistake in her assignments, please correct it right now. Ideally, every lecturer should guide you all like this, how to write it. Because I told even to the Somerset, Mr. Rishad, that I have gotten in university, we give a draft and based on that they will give us feedback how to make sure that the student is on track, which is exactly what I'm doing for y'all. I just wanted to see if y'all are on the right track with the question before it goes to me for proper evaluation. So I still see some people have not understood, referencing not correct. You all have written the question and writing the answer. You all shouldn't do that, So that's what I'm saying. Still, you all have time till the 21st. Not so much for Miss Ganguly's, but at least for Miss Tammy's and my one. Please, please, please make sure that you all watch their recordings also with regarding to the referencing, with regarding to the content, try to get yourself organized. I understand all of you all are working too. I understand you all have families and children, which is exactly why I spoke for all of you all and said that deadline should be extended for you all. I openly said that when we were in university, we didn't have a family life or to take care of, or we were not working. We were just students. So it is only fair that you all should be given extra time. But when I give you all that extra time, also you all need to make sure that you all clear whatever you all have. I will never scold you all if you all can't understand, but I will get upset after asking also so many times whether you all didn't understand and then you all don't respond and then you all make the same mistake again, because it's not fair for me, right? Already my voice is gone because I teach 5 days and then I have to do weekend lectures also, and I don't have a voice by the weekend. It's a lot of stress. So you all need to give justice to that time that the lecturer is giving you all. Okay? So what are your issues, students? Just talk to me openly. What are your issues? Nobody can see other person's face. Nobody is going to judge you all. Just tell me what are the issues that you all are having with this task so far. Part A, B. What are the issues now? Rivka, what are the issues you have in this question? Because you responded very well. So do you have any questions in this? Or Tananga, do you have any issues? Shehara? Metni?
Now, since this is an essay, we have to write it in a, like a paragraph form. That's the thing now. When you say to carry out a risk assessment, as how to pen, writing the thing, this task only, I'm a little bit confused.
Rivka,
You have to use the linking words, no? Then
Yeah.
when we are going to the second paragraph.
Yes, that's it. I told you, students, don't worry about the question whether you need to write an essay or whether you need to write a report. The way you structure your answer is the same thing. I told you, essay and report both will have an introduction, both will have a body part, and you have a conclusion. So what I see from the drafts that you all have sent is you all write the question in that Word document and then you all are writing the answer. No, don't do it. Do like what Rivka has done. Write introduction and you write everything. If it is about risk assessment, give an introduction about risk assessment is this and this. Risk assessment can be of these two types. Risk assessment can be carried out. You need to structure in your head what are the points I'm going to put in my introduction. Don't write a question and then write the answer. No, you shouldn't do that. Students, I already did examples about diabetes and about heart attack. That's what I said. Watch the video, right? I think it was last week somebody sent me a message. I'm not sure, it was Tilani, I think, saying that, Miss, after watching your recording, it is very clear. Even the other lecturers' assignments I could understand well. So I was happy that if the recording has helped, because she couldn't make it to the class, so she has watched the recording and it has helped her. That's what I'm saying. If you all have forgotten or if you all are unable to do, go back, because I'm showing everything manually step by step. Okay. So even in this particular assessment, write about what is risk assessment. Write about how risk assessment is carried out in health and social care. What are the types of risk assessment that you see in health and social care? How do you identify them, that this is minor, major, more serious, not serious? That is what you need to do. Okay. And then part C, they are saying as a conclusion. So which means conclusion part you will write. So here very easy. Part A will be your introduction part. Part B will be your body part. Part C will be your conclusion part. See how much they are giving you guidance and guidelines. That is why there is a word called guidance, is to make sure that you are on track in your assignments. You need to have guidance and guidelines. The reason they use the word guidelines is to make sure that the student is on the right track when you are doing the assignments, so that you can get that desired score. So now if you all ask me, Miss Afrida, which one should be in the introduction part? Part A is your introduction part. Part B is your body part. In that body part, you need to cover this first point, second point, third point. In part C, this is your conclusion part. Evaluate the effectiveness of health and safety practice, policies, procedures in the work setting. So for this, you can say by having effective health and safety practices, you can minimize mortality. That means you can prevent death. You can minimize morbidity. Morbidity means people getting injured, where they can prevent from getting harm to their legs or hands, so that their movement is not going to be obstructed. There could be efficiency in the workplace, more safety, more mental support. If so many things are given in the slides, everything is given in the slides. Is it clear, students, now? Yes. And please make sure that you will follow these guidelines. All three of us are following the same guidelines when it comes to font and formatting. It should be Times New Roman. It should be 12. Margin should be top 2.54, bottom 2.54, left 2.54, right 2.54. Stick to these, because we can directly find out if the student has copy pasted directly without paraphrasing, without changing the font. We can see all this. That is why you need to follow this guideline. Alignment should be justified, right? You have a footer. If you're, yes, Rifka, ask.
Miss Afrida, about the margins, when I, put the margins according to the instructions, the text, the
Yes.
like wording
I
gets
also-
centered and it gets really small. So I asked from Miss Ganguly and she said we can do it to the standard size.
Okay, no problem. If she said that, no problem.
Yes, I also face that problem. Then I add 0.2.
Okay,
0.
Yeah.
Okay, so can everybody stick to what Taranga's margins given as? So Taranga, when you put 0.2, is it okay? Is it workable?
Yes. 0.2.
Okay. Okay, guys. Okay, so questions like that, please ask, no problem. Okay, no problem. Because actually this normal bottom and left and right, it was Miss Ganguly's suggestions to go as 2.54, right? So if
margins can put 1 inch.
okay, 1 inch is also fine, up to y'all. But make sure that everybody sticks with 1. Taranga, can you stick with 1? Or cannot?
Yes, okay.
Okay,
Because
so-
I thought that 2.54 no here.
Yes.
So I thought that it is
2.5 centimeters, Machan. 2.5
Yeah.
centimeters. That means 1 inch.
okay.
Okay. Okay, students, you all can, don't worry about that. Okay, if it is, okay, just for me, no problem. Okay, if everyone sticks with the same margin, then that's fine. Okay, and also you need to follow the cover page. I think that's there. Plagiarism, I have already taught you all, right? And all these sentence structure, grammar, punctuation, all this, right? Referencing, citation, everything is already covered now. Okay, everything is covered now. So before I go to the topic, any question, I'm just going to give you all 1 minute. Any questions you can ask if you all understood or not. Just remember task 2. These are your learning outcome 3 and 4. In your introduction part, cover what they're asking for part A. In your body part, cover what they're asking for part B. And in conclusion, cover what is coming for part C. Okay. So your deadline is 28th of September. I will try to extend it to October. Okay. I will ask Malki and Mr. Ishad, if I can extend my one also to 14 days. Okay, I think it should be fine. Okay, I'm assuming that you all understood because I'm not going to waste any more time asking whether you all have questions because if you all don't want to respond, it's up to you all. Okay, I cannot. There's a saying that I can take the horse to the water, but I cannot force the horse to drink the water. Okay, so it's up to you. Okay.
Excuse me, ma'am.
Yes.
Ma'am, is it index citation also Times New Roman font?
Everything should be Times New Roman. Everything
Okay.
should be Times Roman. Everybody, please make a look at Rifka's assignment. I think this is how you need to write. Introduction. And now when you all write the body part, don't write body, yeah? Don't say body. Don't say body. Maybe you can keep some space, like, just introduction, maybe next part, how can you say there? Maybe methodology, you can write it as methodology and the last part as conclusion. Or even if you just make it as one essay, it's also fine, but just give some space and then in your mind, okay, you think I'm starting my body part from here and then you continue to write and go. And then for the conclusion, you can maybe put a heading like this, conclusion, and then you write your conclusion. Just see how she has written, although the word framework legislation lacks a clear meaning, it is generally understood to refer to legislation that establishes procedures for executive or governmental decisions or that establishes structures procedures. She's giving an introduction beautifully about what is legislation. And she's giving her in-text reference from where she got it. And then she's telling about the UK, right? And then she's going to talk about the safety at work, okay? And see, she will give a referencing, right? It's better, Rifka, if you can give a reference maybe after say health and safety somewhere there, because you are giving the next reference after almost 4 sentences. So in my situation, I prefer at least a reference coming after every 2 sentences. Okay, but this is fine, no problem. But comparatively to other students, you have done a good job. And this is your in-text referencing. Very, very nicely done. So the students who are in this session, just take a look. This is how you need to write your essay. You cannot just copy paste your link. See, this is your in-text reference. Wins and losers had. Rivka, did you use my site this for me? Was it the site that you used? Yes or no? Rivka.
Yes, ma'am. That's the one I used.
So see, that means whatever I have taught has come into use. So you have to make use of it. You all are very lucky students. These are things I found for myself. I had no one to help me. It was brutal. But I'm not doing that for y'all because I understand what it is. So that is why I'm trying to make it easy for y'all. Okay. Anyways, I will not discuss these assessments anymore. You will have deadline in October. I'm assuming you all understood. I gave you all time to clear. You all didn't clear. I assume you all understood. So we will continue with today's lectures. Okay. Right. So to the students who didn't come last week, I will just go through a brief review or a recap. Last week we started about professional development and academic writing skills. So from this term itself, you should understand professional development means in your career, we have something called professionalism, right? How you become professional, the way you talk, the way you conduct yourself, the way you interact, the way you behave, okay? So even I emphasized about the email to y'all is because there was no professional development in y'all to just attach a document and send to a lecturer. And I understand if y'all are not in a university exposure, I can see that because if y'all are in a university, I remember there was one student in my university who sent a draft like y'all, how y'all sent to me, to a doctor. And for almost, I think 1 hour, she went on a lecture about how disrespectful it was. It is correct. It is very disrespectful because when y'all are working with high academic department, they can always judge you based on how you write, how you talk, how you behave. So that is why this we have this curriculum called professional development and academic writing skills. So these assignments that y'all are submitting to me now is y'all are being assessed about your academic writing skills. How well do y'all write? Okay. So the unit aim is 4, number of credit is 20, and you have to pass this, and your grading type will be pass or fail. So we are still under the learning outcome of 1, that is we need to understand what is the principles of professional development. So last week, I think not last week, the week before, we learned about what is professional development. And today we are going to learn about how we can overcome barriers to this professional development, how we can determine the different sources, and how we can analyze the factors to consider when selecting opportunities, activities for keeping knowledge and practice up to date. So we will try to finish these 4 learning outcomes that comes under 1. Okay. So again, if I ask, can somebody tell me what is meant by professional development in health and social care as a review? This is a little bit coming to your assignments also. So can you all tell me what you all know by professional development in health and social care? What do you all think? Students? Anyone? Students, do you all want me to just go like a train? Very easy for me. I will just go read and then bye-bye. If you all, I will now try to implement that strategy from next week onwards if I feel you all are not responding. It's easy for me also. What is professional
Develop
development?
the professional qualities.
Yeah, like what, Taranga? Be more specific. What are your professional?
Yeah, knowledge.
Okay.
Improve their knowledge, skills.
Okay.
Like qualities.
Qualities, very good. How you write, how you speak. Okay. Why do you think it is important in health and social care, Taranga? Your answer is correct, but why do you need professional development in health and social care? What do you think?
Provide the high quality service.
Okay, good. Other students, no answer?
To ensure the quality and of service and the patients or patients receiving the biggest standard.
Very good. Very good. Yes. Lumal and Janaka, any answers? Why do you need professional development in health and social care?
I think we can give trusted and accurate service for any other parties.
Yes, very good, Janaka. That's a good answer.
And
Okay.
higher standards service.
Yes, very good. Yes, higher standard service, quality service, reliable service. Good. See, talk like this. You all know the answer. Okay, right. Health and so yes.
And ensure that knowledge and skills stay relevant and up to date, ma'am.
Very good. Excellent answer. Yes, see, guys, very good. Okay. Health and social care professional maintains and improve the knowledge, the skills, the competence. What is competence? Competence means like something that you are competent means something that you are able to deliver, right? So somebody who is a maths professor, he is competent to do a research in maths because he has the knowledge, he has the experience, he has the skills. That is competent, right? So anything in life, you need to have professional qualities for a professional life. Okay. So this is actually very, I think, even I would say, even not just the workplace that you are working, even if you have to, let's say, even in your family, to a certain extent, it is better to be professional. Okay. Like we say that, professional life is a little bit in formalities. Formalities means, like you need to wear the tie and suit, but of course you don't wear tie and suit at home, right? Because it's your home, you can wear anything you want, you can like eat anything you want. There is like, but of course, when you go to a corporate sector, you are not really the person who you are at home. It's almost everybody is acting. හැමෝම රඟපෑමක් කරන්නේ තැනකට ගියොත්. හරි, especially in a corporate sector. Because you are scared that you will be judged. You are scared that people are going to look down upon you, or you're going to be scared that people are going to gossip about you. So everybody pretends for something that who they are really not. Okay. This is normal. But I would say, okay, how can I explain? So, of course, you're not going to be like sometimes you see you can talk more nicely to the people outside, but are you talking nicely the same way to your family? Like, how you talk, how you respond, right? It can be a bit different. But my advice is professional development is something that if you are really doing it with a genuine cause, automatically your system will adjust to be that same behavior both outside and even in your home, right? So for example, maybe your children are more disciplined in school, but are your children disciplined at home the same way? Or sometimes the children are very well behaved in home because they fear the parents, but not so much in the school. But what I'm saying is, if that professional development is begun in at home front, automatically it will come outside. So it always starts at home. Okay. In the health and social care sector, CPD means continuous professional development ensures that the staff have the skills and knowledge they need to prove high quality care and carry out their role safely. So if I ask in a summary, why do you need to have a professional development? The answer should be in one word: high quality care, and also for safety of the people that you are serving and also for the people who are working, right? This is the main reason that you need to have a professional development. Also, in the addition, the purpose of professional development within the health and social care, I'm sorry, there should be a T here, is to ensure that the care of the patients and the clients receive the highest standard, right? Now, I gave you all many examples. If a nurse is working with a patient, she has to ensure that she wears gloves. She has to ensure that, if she has long hair, that her hair is clipped, that her hair is clean, that her attire is clean, because she has a way of, giving certain, what you call, contaminations to some vulnerable patients who are in the ICU, patients who are very old, maybe the children who have a very weak immunity, maybe the elderly who have a very weak immunity. So it is her duty, it is her role to be professional in how she carries out her work. And at the same time, the people, like the patients who come now, for example, I want to say this, there was a patient I had. She actually had a tooth, and her tooth was actually spoiled. And every time she spoke, there was a bad smell coming from her mouth. And when I do clinical research, I have to work with a doctor. So the doctor didn't have the courage to tell this, and she was a patient who has to visit the clinic very often. So what happened was, the doctor told me, Afrida, could you tell this patient to be a bit more cleaner when she comes to me, when she comes to the clinic? So and because the doctor didn't have the courage to tell the patient, so, and I had to talk to the patient, and for me also it's not an easy thing to do, because of course it's a hurtful thing. Anyone can be hurtful, right? So I had to tell her, then she addressed me the issue, then I immediately told the doctor, and of course the issue was resolved. But if you have the awareness that how clean you are, how well you conduct yourself, you need to have a mindfulness about it before somebody else corrects it. So today, the reason why I corrected all of y'all is about sending an email to me is, before you do it to somebody else and before somebody else corrects it, I wanted to make sure that I correct y'all so that same mistake is not repeated with another lecturer, right? You may go on to your further diploma, to your degree, to your master's, whatever it may be. And definitely at one point in your life, if you send an email to either your boss or to anybody, either you all already knew to write a professional email, but you all didn't take it seriously because it's me, or because you all really didn't know. But either one of the ways, whatever that was done was not right, which is why I corrected it. Because we are all here professionals. I am dealing with you all professionally, and you all are dealing with me professionally. So we are here to develop, not only help. That's what I told you all at the beginning of the lecture. For me, this module is not about you passing this assignment. For me, this whole course should be, what are you gaining practically by end of November? Because you all are almost now going to finish this module, right? It's a 6-month, OTHM is a 6-month course. So after 6 months, if I know that I have made an impact in your lives in some way, for me, that is an accomplishment, right? So there were already students who told me sometimes the way they speak, they have learned how to talk better. That is a development that you all have gained from this course. Or if you all have improved. Now, why do you think I took so much trouble and got irritated by your writing is because, remember, writing skill is an essential skill in your life. Computer skill, writing skill, communication skills, your math skills, these are essential skills. Regardless how many years go by, it will never ever change, because these are the skills that you will need even as time goes on. You don't need the skill of, let's say, the skill of a skill that is outdated is maybe, let's say, a skill pottery. Hari mati වලින් වලං හදන එක, it's okay, it's good to do as a hobby, but it's no longer a skill that can help you in the future unless you try to make a business out of it. Okay, but skills like writing, communication, maths, and what do you call your the way you deliver, the way you present, these are skills that you will need even time to come, which is why I was taking a lot of trouble, because I want to make sure that end of this course you have gained something in yourself. Okay, right. Why is professional development important in health and social care? So just remember, main thing is high quality care, and to carry out the role safely. You need to have high quality care and to carry out their role safely. This is the main reason. So aside from that, it says it allows individuals to continually upskill. Now, what do you mean by upskill, students? What do you mean by upskill? You have a skill, but you upskill it. What does that mean? Can you give me an example? What is an upskill? Remember, in life, nobody was born a writer, right? Nobody was born as an orator or a communicator. Everything is a development. That is why we are studying this module, development. What do you mean by the word upskill? What do you understand by upskill?
To improve or make it better.
Very good, to improve it and make it better. And how do you do that, Rifka? How do you improve and how do you make it better? Do you use one word? Can you-
Yes, that is with training.
Well done. That is with practice. That is with practice. That is why they say practice, 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 because practice can make you perfect. Okay? We don't need to be perfect, but we can strive nearly to perfection. Okay? So yes, that's a good thing. So like usually, like say maths, maybe geometry, maybe algebra, maybe certain areas of maths, maybe you found it hard. But what do? You practice and practice and practice, and maybe that would be something that you're really good at. It always starts with practice, students. You have to understand. Even a singer, through practice, becomes better in singing. Even an artist becomes better by drawing many, many things. Even for me, I didn't become good in my academic writing by just writing assignments. Like y'all, I told y'all when I got the first assignment in university, I wanted to quit university because the question was very hard. I couldn't understand. I just want to give up altogether. But I sat, I researched, I went and watched YouTube videos, I worked for it. And then when I sat, I could slowly get my ideas. That is why students, when remember, being an adult is hard. It's not easy because you're always on your own, right? You are looked as an adult. You are expected to work as an adult. Your work will be delivered in an adult way. So you need to life is like that. It's hard, it's brutal, but that is a reality. It doesn't mean that you cannot ask for help. Of course you can ask for help. Everybody needs guidance. Everybody gets upset. Everybody can make mistake. That is not the problem. But how much do you develop yourself? And for development you need certain soft skills. That is, how far you can have the grit, how far do you have the determination, how far do you feel like you have the resilience, like you don't give up soon, you can continue to go on. These are also developmental skills. Okay, so the first one is upskill is a skill that you have, you try to increase it further by training or practice. So they are saying regardless of age, regardless of job, regardless of level of knowledge, it can be anything. You cannot give it as an excuse. You can still continue to develop professionally, even though you're old, even though you don't have a high paid job, or even though you're doing a low paid job. It doesn't matter. If you have the passion, if you have the determination, if you have the resilience, you can still continue to do so. In addition, the activity stops practical and academic qualification from becoming outdated. What do you mean by outdated, students? I gave you all an example. What do you mean by outdated? I told y'all Nokia and Android, right? The reason Nokia couldn't keep up anymore because Android company, the Android CEO, he was always up to date about everything, about the latest coding, about latest platforms, about many things. So he could bring his product to the market and he could make his product more competitive, that eventually there were more customers who bought Android and Nokia became pushed out. It's like Ara Darwin's theory wage tama, survival of the fittest. Whoever can hold on, whoever can fight and be resilient can survive the adverse effects and can go further. It's the same thing. So what I try to tell, especially when you are in science, when you are especially in healthcare management, you need to be uh, up to date. That is why they say watch the news, read the papers, read more books. You need to go and also try to uh, not make friends only of your age. Have friends who are below your age, above your age, of your same age. Okay, because everybody has something to offer you in terms of knowledge, in terms of skills. It is the truth. Okay, so make sure that you are not outdated, right? It is also comes with, as long as you have the determination, you will never be outdated. You will always have that what do you call knowledge and that passion to keep yourself keeping up to date with everything. Anybody has any suggestions with this? Nifka, anything that you would like to add? It's always about, you know, the commitment that you put to your life. How much commitment can you be? You know, I understand that everybody is how to say, everybody is going through difficulties in life. Everybody has challenges in life. Everybody has issues in life. Okay, but that cannot stop you from what you want to achieve in life. That is what I want to say, right? That cannot stop you. So the first accomplishment that I see in all of y'all is, regardless of your age, regardless of having families, regardless of being parents, right? Regardless of having jobs, you all still gave time to do this course, right? You all still gave time to select this course. So that is something that you all need to applaud for yourselves, right? Because regardless of any situation that you all have, you all still want to strive for knowledge. That is a very good thing. One thing I want to say, I see so much now. I'm in Bangkok, right? And I actually really miss my students in Sri Lanka when I was a teacher, because how to say, only when you go outside the country and when you start working with certain people, because one thing I can tell you is, Thai people, unlike the Sri Lankans, are not ඒගොල්ලන් සාමාන්‍යයෙන් emotions ගොඩක් හිතේ තියාගන්න මිනිස්සු. හැබැයි they keep those hurt and anger, and they can take revenge in a very indirect way, right? But Sri Lankans are not like that. අපි කියන දේ කෙලින්ම මූණට කියන මිනිස්සු. That's something I really love about our country, right? We have more professional development. And even in our country, when the teacher walks in, they stand, they greet, they when the teacher leaves the class, they stand, they greet, and they thank you. In Thailand, it does happen, but not to a great extent as Sri Lanka. So I would say, as a country, that's what I always say, I will always love the values given to me by my country. I don't know whether it is my country or whether it is my family, I do not know. Or is it the school that I went, I do not know. But I love the way I was brought up. And I lose my temper last week also. I had a very bad temper with my students. I literally screamed in the class. I shouted, and my voice was very loud, that literally all the teachers had to walk and see what was happening. That is me, because when I don't get that due respect, I get very upset. That is my nature, because I know how much I respected my teachers, and that was the blessings that I got for this day. Today, my blessings in life is because I am a believer of my Lord, and the way I worship to my God, and the way I respected my parents, and the way I respected my teachers. This blessing, students, will definitely come back to you all. And I know in this forum, there are Buddhists, and you all believe something called karma, and I know that Buddhism has a very strong teaching about respecting adults. That's what I want to tell you all. I love the way our country has given values to us. We should be very proud as Sri Lankans of how we are brought up. It is very true. And when we are brought up with these values, it is very easy for our professional development. And now the iPhone 14 has come, and everybody is very worried about iPhone 14. But look at the Sri Lankans. I know when an iPhone 14 comes, we are not bothered about these things, but we are bothered about how far we are going to make up to our next exam, what are we going to do with our careers, how far we can make a difference in other people's lives. So this is Sri Lankans. We give values to bigger things in life, not just to materialistic things. It is only sad that what has happened to our country in terms of politics. If not, our country is a very great country in terms of a lot of things. Eka, I am telling you all, students, all of you all speak very good English. In Bangkok, only the most extremely well people speak English very well. And that is why I get very upset when I ask you all question. I don't know why you all get upset to answer. If I go to Anuradhapura, Polonnaru, and I ask a student, what is your name? Give me an introduction about yourself. They will beautifully explain to me in English. That is Sri Lanka, right? But in Thailand, if you go to a village area, if you ask them to talk in English, they cannot even say my name is so and so. So You have to, that is why I want to give you my experience in life. But of course, there are other great things about this country which Sri Lankans don't have, like getting into a bus, they don't want to stay in the queue. There is lack of honesty. They will try to cheat you. Those are the little things I don't see in Bangkok. Or if you get into a public transport, men are always there to physically harm a woman. That I don't see in Bangkok. So I see the pros and cons, definitely. I cannot always put Bangkok down because I see good things also. But what I'm trying to say is, overall, a majority of the quality people in Sri Lanka has better values, and it is easy for professional development. Okay. So, and I always say that Sri Lankans are very kind and they are very helpful. We are very supportive people, right? This value is, don't ever take it away from yourselves. Wherever you all go, have that qualities in you all. This makes our country as a good nation, right? I know we are, and like I know Sri Lanka, we are very generous, we are forgiving, we are very friendly, we are supportive. Those qualities, Bangkok, Japan, China, they are more like robots because so much of technology. ඒගොල්ලන් තාක්ෂණයත් එක්කම හැදිච්ච මිනිස්සු නිසා සාමාන්‍ය මිනිස්සුත් එක්ක when a person cries, they don't know how to make that person okay. They don't know how to, ඒගොල්ලන් වැරද්දක් කරොත් sorry කියන වචනේ හරිම, you cannot get the word sorry from them. It is a lot of ගොඩක් අපි කියන්නේ ඒකට උඩංගු. හරිම උඩංගු මිනිස්සු. හරි? But we are very humble as a country, right? But you have to know, for a professional development, you have to be humble, you have to be professional, you have to be forgiving, you have to work with ethics, you have to be respectful. This is your success in life, students. This is your success in life. And you will understand, when you have these qualities today, it is not the most intelligent person that goes far in life. It is the most emotionally developed person who goes far in life. Remember that. Tamange කොහොමද කියන්නේ ඒක, soft skills. If you have improved your soft skills of how you talk, how you interact, how you are humble, how you are friendly, right? Friendly කියන කොටත් not overly, but professionally, how you are. That is very important. Okay. Anybody can add anything for this? Anybody can add? Students? Rifka, anything you all can add for professional development in terms of qualities?
I think even to have professional qualities, I think we should have empathy.
Yeah,
That's what I feel.
very good. Yes, I always, this is what I think at the very beginning of my lecture back in June, I always told we have to have the quality of empathy. It is a very important quality that you have to have. And today I see that quality going down day by day, right? Doctors don't have it for the patients, right? So many professional managers don't have it for their corporates, So it is a lot of issues, So yeah, that's a good thing. Professional development is an empathy thing that you need to, yeah, that's a good one. Any qualities, other qualities that you all can add, students?
Effective communication.
Yes, effective communication is a very important thing. How do you communicate? I always say, if you have one good thing that I always look forward is, if you have a problem with me, you need to address the issue with me first before. I think I always see is the worst thing that today the society, the world is collapsing is, the main thing is about gossip. හරි? කෙනෙක් ගැන තවත් කෙනෙක්ට කියනවා, එක්කොත or බොරු දේවල් පතුරනවා. ඒ වගේ දේවල් කරන එක තමයි මං කියන්නේ very, very unprofessional. If you have a problem with somebody, go and directly talk to that person. Okay, what you did to me on this particular day, I don't like. I wish you did this way better, and this is what I like. This is what you need to do, right? This is what you need to have, effective communication. Because if you, ඔයාට ධෛර්යය තියෙනවා නම්, if you have the courage to go and tell lies about somebody, but you don't have the courage to go and tell that particular person what made you upset, then I think as a human being, that human being is a very low level place, in a very low level place. But if you have the courage to go and directly tell to this person, okay, I don't like this particular situation, this particular thing happened, you need to, I always told you, you need to go and confront the person who you have problem with. This is a big professional development in life. Remember, I also told you, everybody in your workplace, හැමෝටම ජීවිතේ වැඩ කරනවා නම් කොහොම හරි you will have at least one person you will have a hell life with. කවුරු හරි you will have somebody who is going to be jealous with you, or who will bully you, or who will gossip about you, or who will bring you down. But you also need to have a professional way how you are going to deal with this person. Okay, I have had enough experience in my life, so now I will give you another example. When I was working in Bangkok as a researcher, right? When I was working in Bangkok as a researcher, and when I was working in the lab, I was very new to the lab, and certain things I didn't know. And because they were Thais, they couldn't also explain to me properly in English. The English was very bad. So when I made certain mistakes, they wouldn't come and tell it to my face. They would go and tell my mistakes to other people in the lab. So eventually the whole lab would, talk about the mistakes, or they laugh about the mistakes, but they never had the courage to actually tell it to my face. And this was also another foreigner who was involved in this situation, who was talking about me and telling about me to other people. Today, she is now trying to look for a job, and I have already got a job. And I usually don't hold grudge with people, but I'm also a human. If somebody has done something wrong to me, I will keep it for a long time in my heart. This is me. I will think about the situation. If I can forgive that person, I will forgive. But remember, when somebody has spread lies about you, or fake information about you, or if somebody has shattered your confidence, I will never forgive that person. I will keep that hurt and pain in my heart for a lifetime. This is me. So today I told her, this is my God's blessing. I have got a job in Bangkok, and now she's asking help from me to get a job in Bangkok. So today I actually bought all the past of what she did to me. This is me. So she got embarrassed, right? So remember, this is karma. Whatever the bad you do or whatever the good you do will come back to you eventually. But if she has professionally confronted me, oh, Afrida, you made a mistake here. This is how you need to do, and this is how you can handle it. I can understand that is done professionally. Now, even today, when I corrected your drafts, I didn't put anybody down openly. I didn't say that you all are bad in academic writing. I didn't say you can. I will never put a person's confidence down. I only said, after giving 3 sessions also, still some people don't know how to write the introduction properly, and only one person did it. That is how you need to handle, because remember, we all have feelings. We don't need to be a child. We don't need to be a teenager. Even if you hurt a 60-year-old person, he will get upset. 50, 30, 20, everybody has feelings. So that is why I always say, be very careful how you talk to people, how you handle a situation, because it can go a very far way. You never know when you are going to meet this person again in life. You will never know when you will meet this person in life. That is why I say, be very careful in how you talk information about one person to the other person. ඔයාට කෙනෙක්ව අකමැති නම් just stay away from that person. Don't go to spread gossip or false information about that, because eventually that person will get to know that you're spreading false information about them, and that feels very, very hurtful. It has happened, like students, මට ජීවිතේ මාව පහලට දාපු මිනිස්සුන්ගේ, they always come back to me for help, and I don't help them back sometimes. And I don't know whether I'm doing it the right thing, but this is me. But whoever has been good to me, I'm ever ready to give anything to them, right? So this is, I'm telling y'all, empathy, talking effectively, doing the right thing at the right time is all professional development. So I'm telling you all this with examples. Okay, right. Actively can help improve your confidence, and it can also help individuals to prepare for the inevitable change and improvements that made in the healthcare sector. Anything in life, sometimes I always say, you don't need to look beautiful, you don't need to look fair skinned, you don't need to be rich, you don't need to be famous. If you have the confidence for who you are, right? If you have trust and faith in who you are, it is another professional development. Because if you are confident in yourself, automatically the person who sees in you. So I will give you another example, right? So this job that I got in Bangkok, it is of 50 nationalities. So the whole, like, you have every country, you have Australians working here, you have Americans working here, and the person who interviewed me was a British person, right? So the first thing that before, but the one who did the administration was a Thai lady. So the first question she asked me was, can you remove your hijab, the headscarf? I said, I cannot do that. I cannot do, because this is my religion. But when I was interviewed by a foreigner, he could see through what I could offer to the institution in terms of teaching, because of confidence of who I was and the way I spoke and the way I gave. Okay, so he said the way I wrote, there were 15 questions that I need to write, and said that the way I wrote was very good and the way I presented was very good. So it doesn't matter what religion you are, or what skin color you are, or what background you come from. As long as you have integrity and as long as you do the right thing, you will always have a place. So that is why I want to give you the experience of my life, so that you will know how you can bring the development professionally, right? This is something that you all need to know, not just in health and social care, right? Any job that you do, if you know how to behave professionally, you can last for a lifetime in that place. Okay, of course, we will all have reasons to move out if we want to develop in ourselves in a different way, or whether you have a different interest. That's okay, that's fine. But what I'm trying to say is, if you have professional qualities, you will always have that stability to stay in that place with confidence. So you have to know how to build yourself with confidence. So one of the reasons in this lecture I make you all to interact is also to improve your confidence, because I am never going to put you all down by your grammar or by your pronunciation or by your answer. I just want you all to gain that confidence so that you will talk. Okay, right. Anything else, students, that you all feel in your own ways, in your sectors, how you all feel that professional development can help you? Personally, any personal experience that you all have, students? Any personal experiences? Rifka, what about your personal experience in professional development in the place you're working? I remember you said you were working in a call center once, and I'm not sure where you are now, but how has professional
I used to work in Dialogue call
dialogue?
center.
Very good.
So every month we were like given trainings on how to improve our soft skills, then our technical skills and everything. And once a year there was a evaluation, skill evaluation, like that. Those really helped me. Yes. So
Yeah.
every month we were given a training. So before we were like deployed onto the floor to answer calls even, like they made sure that we were given like body trainings to how to make the calls and everything. So after even like when we were doing training, making calls also, there was a senior person who were next to us to assist us in that. And our team leader was there. So I think it was a good experience for us.
Exactly. See, and you mentioned the word soft skill. So these are your soft skills: effective communication, empathy, integrity, right? Understanding, kindness. These are your soft skills. Okay, right. Okay. Activities that can be implemented for the development in health and social care. Can you all tell me some activities you can implement for the development in health and social care? What kind of activities you think you can implement? It's already on the screen. You can just elaborate it a bit. Janaka and Pubudu Lahiru, what are your activities you feel in your corporate sector?
Yes, I am giving a teacher training.
Good. Can you tell me, Taranga, what kind of trainings, categories of trainings are you
Yeah,
doing?
we are engaging with the small kids now. So I'm giving some train how to behave with the small kids.
Good. Behavioral skills, good. So it comes under behavior. Any other students, what are the skills that you all give in your training, or what are the skills you have got in your training? Can you all tell me?
Yes, ma'am. I gave how to draw blood screening. How
Wow.
to
Wow.
yes. I am doing blood screening for malaria, and I train my juniors how to do that.
Very good. Who was the one who spoke now? Is it Metni or Tilani? I'm sorry, or Shihara. I'm not sorry. Tilani? Tilani, can you tell me what are the, have you had any issues with your students in terms of behavior?
Sorry, ma'am, I couldn't hear.
What are the behavioral skills you have given to your students in when training? Have you found students with attitude or behavioral issues when you're training, or you have found them respectful towards you? What are the behavioral training that you usually tend to give, or is it just technical skills you give them? Can you give
Yes,
me?
yes, it was just technical training, madam.
Okay.
Not behavior changing.
Yes,
Also there.
because they are anyway respectful, right? You don't have issues in terms of attitude, because I understand. How old are they when you are training them? These students, how old are they? How old are they? These students who work under you.
I think 25 or
Okay.
20
Yes.
years old.
Yes, of course. That is not an issue, because by 25, they are already mature. They know how to do it. Okay, good. So that's good. Any other, Rifka, what about training sessions that you have got or given in terms of development? Not just healthcare, social care, but in your sector, what are the trainings that you give usually? Lahiru,
I'm giving knowledge
yes.
training also, because I'm training them how to do the daycare thing, like how to fold the things and like kind of things,
Good. Yes. So
and
you,
how to change the pamper, like kind of things.
yes, good. So that's the thing. So the training now for Taranga, it's with children, very small children. So her training development she has to give for them is different. But Tilani is giving for some maybe diploma to students who are much more older. So her way of giving training is a different. So you have to understand, training that you give will also differ from age wise, from sector wise, from the type of job that you're doing. Okay, but anything I always tell, make sure that you give them the training, you give them the knowledge, you give them the skills, and you give them the guidance. Very important is you have to give them the guidance, right? And you need to give them confidence. Whenever they do something good, always ensure to give them that, knowledge, that appreciation, that confidence that they have done a good job. I always do this to my students, because a vote of confidence will always make them to go very far. But also you need to correct them wherever they need to be corrected. Okay, so before it gets too out of place. Okay, right. So observation through shadowing. Does anybody know what is shadowing? Does anyone know what is shadowing, students? What is shadowing? So shadowing means, let's say that you have joined a company very newly, or you have joined the organization very newly. You let a person who is very well trained to make that person to follow this extremely trained person. So it's like an intern, right? So a newcomer will join a highly trained person. So this newcomer will observe, okay, let's say blood drawing or blood sampling. Whoever has not done it at all, this person will follow the one who is an expert. So she gets to observe what are the things that they do before drawing the blood, how they are drawing the blood, what are the steps taken, what are the precautions taken, so that she gets to know what to do next time. Okay, so you will give a training maybe 3 months, 6 months, okay, not more than 6 months. Usually you will have a training of 6 months. This is a must. And that is why just imagine the expert is not given the proper rules and regulation. He will give those same flaws to the one who is under the trainee. That is why in life, always learn the right thing, so that you will do the right thing to your juniors, and your juniors will do the right thing to their juniors. So that is a chain, okay, a chain. So if your superiors do the right thing properly, they can give the right thing to the juniors, and the chain can continue to go on in the correct way. Okay. So observation through shadowing. So the manager can maybe observe, okay, the trainee is now doing an internship under a senior. Let us see how she's performing, how she's following instructions, how she's respecting her senior, how much she can take it up, how much she is following instructions, like that. Okay. Second one, attending conferences. So always like try to attend certain workshops, certain conferences. Like Taranga, in your basic life support, do you have workshops? Or are you done with your basic life support course? Are you still going?
Yes,
Yes.
yes, we went.
Okay. So do you have workshops also, or yes, or just normal lectures and classes?
Normal lectures and classes. They gave us what is that called? Uh, mm, what is that called? Like workshop tamai.
Like workshops.
They gave yeah, training. So
Training. Yeah. So usually you can have trainings through workshops, you can have trainings through conferences. Reasons why they
Miss
are.
Afrida, sorry, I got locked out again, so that's why I couldn't answer your question.
No, Rifka, my question was, what are the trainings that you have given to your workplace, or what are the trainings that you have got from
So
your work?
mostly they have given us the product and services trainings, then customer service trainings, and also like there was once they were choosing employees for outbound sessions, outbound processes. So they made sure that we were given trainings to improve, to improve different kind of accents, to be able to handle different kind of processes, be it a UK process or a US process. So even the accent plays a big part in handling those outbound operations as well. And also leadership trainings. Those are the kind of trainings.
I really, Rifka, I think I really noticed one thing about you. I'm honestly not, I don't know you very well. But what I know is whatever that you are doing right now, I feel you are giving your best. I'm sure you have your bad times, but I can sense it that you respect to what you do, and I can see that you're very confident in what you're doing. That is something I have to really appreciate, and I'm happy for you for that. I honestly don't know you very well, but from what I want other students to know this is confidence. I see confidence in her. Sometimes students in life, you might not be doing exactly what you want, right? That is the reality. Sometimes we don't get to do what we really want or what we are supposed to do. But at least if you can, see that positive side of what you have got from that little thing that you're doing, that shows that you are appreciating to what you are already gained. So Rivka may be not doing exactly what she really likes, but I feel that there's confidence in her and appreciation in what she has achieved and got from that. Okay. That is a professional development. I can see a professional development in you already. Okay. Right. Participating in workshops, you need to do that. You will meet people of different backgrounds. You will meet people of different ethnicities and nationalities and different work backgrounds, different age, and you will always have a lot to learn from each one of them. Okay. Reading around a certain subject. Now, if you have to do an assignment with healthcare management, read a little bit about risk assessment, watch YouTube videos. When I had assignments, I didn't just read, I used to watch videos also, right? Because certain things I could understand better to write my assignments by watching the video. Okay, so you have to read, you have to know about what you are asking for. Okay, taking a role relevant course. If you want to go further in healthcare management, your first step was, okay, you started a diploma in OTHM. Okay, what are you going to do afterwards? Maybe you have already figured it out. Okay, mentoring a new colleague. Always I tell you, the best way for you to gain additional knowledge or to be better at something is always try to teach somebody else. Like, this was the first thing that was taught in my school. If you want to be good in maths, try to teach another student who is weak. So by teaching that student, you are going to get better, and also you are going to give that knowledge to a child who is weaker. So always mentoring a new colleague or a junior or a new trainee, you are always going to get better. Okay. Access to training such as NVQs. I will talk about NVQs in the future. Don't worry about that. Work experience in other clinical areas. So if you have work experience, say in a call center, don't ever think that that experience is not going to help you in the next job role. No, it's going to help you in something. Remember, nothing is going to be a loss. Nothing is going to be a loss if you have the ability to make use of that experience. I always tell myself and I always tell my students, experience will be your best teacher. Experience will be your best guru, because that is also if you have learned it from that experience. But if you tend to make it a repetitive mistake, then it will never be your experience. But so, for example, let's say today you learned that how you need to write an email, right? Next time, I'm not going to repeat how you will take it, but I will know how I will deal with your. But if you do not learn it from me, there could be somebody who is going to be extremely, be very aggressive towards you. But if you learned it from me, you will not repeat it again with another lecturer. So I will tell you another example. When I was in clinical researcher, we have staff meeting, and our staff meeting was always conducted by a professor, Professor Asita. He's a neurosurgeon. So I remember to this day, we got late, myself and another colleague. The meeting was supposed to start at 11 a.m. I think we went at around 11:05. That 5-minute delay, he actually, actually not me, but my colleague, because I was a new trainee, he didn't actually say anything to me. But my senior, she has worked in the company for 3 years, and he already knew the names. The way he insulted her, that was it, in front of the whole staff. I actually don't think that is a professional way to do it, even though that's what I'm saying, students. You can be a professor, you can be a lecturer, you can be a doctor. You cannot insult somebody in front of people. I always told you all at the beginning, it is one thing that you correct that person only alone, but you cannot insult somebody publicly, because he may be a professor, he may be a doctor, but that doesn't give him the authority to insult somebody in front of a large crowd. But what I learned from that thing that day was, if I know somebody is going to get delayed to a meeting, I will not wait for that person, right? Because by then he should know, if meetings are professional, you need to be on time. There cannot be invalid reasons. You need to make on time. But what I learned from that professor is, he may be a professor, but the way he insulted her was also not a right thing. So there are ways that you learn things, how you perceive it. Okay, so 2 things. If you are supposed to attend a meeting, a professional meeting, try to be on time. If you couldn't make it on time, and if you know the person who is conducting this meeting has a bad mouth or a bad temper, don't attend the meeting at all, just to save your dignity, right? Just to save your dignity. But if you know that this person is going to make a fuss for delayed meeting, try to be on time. And also, if you have something to address an issue, always deal one-to-one. Don't insult a person. That is the other thing that you can learn. Okay? Right. What are the barriers to professional development in health and social care? Can you all tell me, students, what are the barriers in professional development in health and social care? Can you all tell me? What are the barriers? What are the barriers you all can face?
Communication. Yes.
Okay. Communication, yes. Those are your barriers. One. What are the other barriers?
Lack of time.
Time management.
Very good. Lack of time management. We all face this today. Work-life balance. Okay. Yes. Time management. Lack of communication. Anything else? There are many more to go. Can you list down more? What else?
Lack of resources.
Technology.
Lack of resources, lack of knowledge. Okay. What else?
Technology.
Lack of technology. Very good. What else? Empathy, sympathy, understanding, respect, integrity, doing the right thing when no one sees you. Okay, are you doing okay, nobody is going to see you what you're doing, but you need to know that somehow or the other, if I don't do the right thing, it can surface in some point, especially like I told you last time also, that clinical research, she was forging clinic notes, she put a wrong data, she wanted to hide the mistake, then she did another mistake another wrong thing to hide that previous wrong thing. So integrity, you're doing the right thing when nobody's watching you. That is integrity. It's a big, huge part of a professional development. Okay. Lack of time, not having the capacity to fit additional learning into the working day, shortage of staff, that is true. When people go off, there could be extra work coming onto you, and when that extra work comes onto you, you lack time to make time for your family. Because I think, how to say, today, this lack of time is a problem to everybody, right? Because that is exactly why I suggested that they need to give you all more time for your assignments, because personally for me, I can never work and study. This is my limit. I cannot. When I finished my BSc, I said only BSc. When I finished my MSc, I said only MSc. I resigned the job and then I went to my masters. Now that I'm off my masters, I can work, but I cannot work and study. This is my strength. Okay. So students, give me 1 minute. Just give me 1 minute. I will take a 1 minute break, guys. Okay, just give me 1 minute. Okay, students, I had to go for a religious a thing for a while. So I'm back. Yeah. So what I was saying was, yeah, lack of time is an issue and shortage of staff. Yeah, these are normal things that everybody will go through. Time management, right? We always feel we have a lot to do with a given limited time, and especially when you have a family to go with and then you're working, sometimes the things that you couldn't do in weekdays you try to catch up in weekends. So sometimes it's your studies, so sometimes it's your maybe your courses, or even sometimes you try to bring your office work back to your home because you just honestly, it's not because I wouldn't say that because we lack time management. Sometimes it's just a lot to do. I really disagree with the people who say, oh, you do not have time management. It's a very unreasonable thing to say because I personally know sometimes you can be loaded with more than what you should be doing. And it is the truth. That is, like, for example, shortage of staff. It is a reality. Maybe in a company, there were suddenly people have started to leave, and then you have to catch up those people who left. Or maybe there were like 2 or 3 people got sick, some had gone for a personal reason, so now the workload is on you. So it is really not about someone has the deficit to manage time. There are situations, yes, there are people who, don't take things seriously. Maybe they are just not giving the proper time management, just doesn't have the proper way to manage time. But there are still people who are just loaded with more than work than they should be doing. Okay, so example is staff shortage. Okay, lack of IT skills and resources. So that is why even before I told you there are skills that you will need, which will be there for a lifetime, that you need to know, that doesn't change with years. IT skill, math skills, communication skills, writing skills. These are skills that you will need to have even in 10 years, 15, 20 years time. Okay. Shift patterns. This can make accessing learning more difficult, particularly for night shift workers. So, for example, some people, they are not very good in working in the night. Now, for example, I have a friend. She has to work for an American company, and her body has now literally, literally, she's actually facing a lot of health issues now because of this night shift. Because humans are supposed to work in the morning, but we are supposed to sleep in the night. And when you turn this biological clock, your body doesn't respond very well. You can start gaining weight, you can start losing hair, you can start, get a lot of mental issues. It is happening to my friend now, but she has no choice. That is the company she has to work with. She has a family to feed, she has a father to take care of, she has to bring food to the family's plate. So this is a reality of some people's lives. That is why don't ever be the one to blame somebody if you don't know the reason, right? You have to understand, if a lecture is being missed, you have to understand that lecturer is not missing the lecture for no apparent reason. There is a valid reason that a lecturer is missing a lecture. Like I said, we are all going through a lot. If I can have understanding that you all needed time for lectures, then you all also need to have the understanding that this lecturer couldn't have a lecture today is for a valid reason. For me, truly, I hate to have lectures on a Sunday and a Saturday, because to me it is a lot of time and energy after 5 days of work. But because I have signed up for it, I am doing it. But that is why you have to understand, everybody is doing it with a lot of sacrifice, with a lot of difficulties, with a lot of limitations. You have to give that understanding. Okay, so shift patterns, some working have to work in the night, or some have to work long hours, and it can be a barrier to the professional development. Lack of funding, that is true. So there could be certain institutions, if you have to work with hazardous chemical or toxic chemicals, they do not have basic things like mask. They do not have basic things like gloves. Is it the right thing? No, it's not the right thing, because you don't have funding, and then you are expected the employees to risk their life and health to serve the company. And I have already told you all what you all need to do in these situations, right? If you feel your health is jeopardized, your health is under risk, you need to give yourself the importance to walk out. It's not just about safety, but also like last time we heard Taranga's experience. She was under a situation where her safety was actually under risk. She tried to confront the person who was doing this. It didn't work, and she walked out. And today she has started her own daycare. So that is the thing. In life, I always say you have no excuse. Yes, life can be unfair to us. Life can be very, like, certain bad things can happen to us in a very unexpected ways. But I would say that don't blame your situation, don't blame the consequences. Okay, it happened. Yes. Maybe what is it trying to teach me from this situation? You have to always ask yourself. And once you overcome it, and when you look back, you will be so proud of yourself. I didn't let that difficult time or that difficult situation to stop me from where I had to go. So I think as Sri Lankans, sometimes we love to blame. We love to blame. Especially the Asian mindset is we love to blame people for circumstances. Because this person did to me, I cannot do this. Because this situation happened to me, I couldn't go forward. Because my parents didn't have money to educate me, I couldn't go to university. That is why I tell you from this, regardless of your situation, your age, your financial status, whatever the situation, you cannot give it an excuse. අපිට වඩා ජීවිතේ කටුකාපු මිනිස්සු ඉන්නවා ඉදිරියට ගියපු අය. You can watch enough and more videos in YouTube. People who with cancer, people who lost their legs and hands, people who have gone blind, didn't stop from their adverse situation, but they kept on moving. Everybody, like including me, when I have difficult times, I want to give up. It's normal. Sometimes I cry. Sometimes I get very upset. Sometimes, we are all humans. I always told last time, when you have to manage a stressful situation, it's okay if you cry. It's okay if you can deal it in a different way, but don't give up. Whatever the situation, don't give up. Today, your assignments, whatever you all wrote, don't get upset by not getting a good write-up. It's okay. When I wrote my MSc, almost 20 times I had to correct it. And sometimes I used to think, oh, my professor has a personal grudge with me. That is why she's making me to correct it over and over again. No, that is a wrong way of thinking. It's understandable for you to feel that way, but you have to understand she's doing it just so that you will be a good academic writer. And today I'm happy that I went through that. I remember I had almost a day 7 cups of coffee to finish a thesis. It's a word of 20,000 word count. So you can imagine. And I get calls at 6 in the morning, come to the lab, this is wrong, correct it now, this is wrong, correct it now. And it's brutal. It's very, very brutal and very much stress. That's why I took a break from research and I went back to teaching and lecturing, because I thought, okay, I want a break from lab. I want a break from research, because it's a lot of stress. It's a lot of things that they demand from you. But hopefully I will go back. I might not go back. I do not know. I have not decided, but I'm trying to do better what I'm doing right now. Okay. So always try to understand, and always what I say is, හැමදේම ජීවිතේ හරි විදියට බලන්න, you have to train yourself. අපි කියන්නේ perseverance. I mean how you perceive it, and perception, how you perceive and what is your perception. I don't know in Sinhala what you call it. තමන්ගේ ආකල්පය කොහොමද? ඒ කියන්නේ දෙයක් බලන විදිය, you have to change the direction, right? හැමදේම වැරදි විදියට බලන්නත් එපා, වැරදි විදියට හිතන්නත් එපා. තමන් බලන විදිය හැමතිස්සෙම ඒක you have to see it in a very positive way. හරි? You have to see it in a ධනාත්මක විදියට හිතන්නත් ඕනේ, ධනාත්මක විදියට බලන්නත් ඕනේ. ඒක හරි important when you are developing it in a professional life. Okay? What are the possible ways to overcome barriers, students? Can you all tell me? What are the possible ways that you can overcome?
Practicing.
Practicing what? Practicing what, Taranga? Practicing maths, practicing what? You have to be more elaborative. What is it that you are practicing? In what aspect?
Practicing professional.
In what? Practicing the way you speak or way you talk. What is it that you will practice? Ifko, can you tell me a elaborative answer? How can you overcome barriers?
In always, we should motivate it.
Very good. Yeah, motivate. Yes, very good. Today, I think motivation is very less. You understand? We are expected to go to work. Okay, මේ අද තියෙන වැඩ මේ ටික කරන්න හරි ඉවරයි ගන්න ගෙදර හෙට මේක තියෙනවා මේක කරන්න එච්චරයි. No time to give them okay මොනා හරි අද ප්‍රශ්න තිබුණාද මේකත් එක්ක did you have any issues, did you face any difficulties? You know, that's why I said today we are all tend to work like machines, that we have forgotten to give understanding for people's emotions, how you empathize. You don't want to listen to them, you don't want to understand them, you don't want to face reality because you just expect them to work like robots, go home, come back the next day. It is a monotonous pattern. That is why even in my lecture sessions, I do not want, emphasize again, I do not want a lecture just that I go and read, but rather I want to interact, so that by interaction, one thing is you all don't feel like, okay, you're just, because you all can listen to the recording, right? If I just read it, you can just listen to the recording. But when you interact, when you're given the chance to interact, you are allowed to give your thoughts, your opinion, your feedback. You share your experience, right? Every 10 of us here have a story in our lives. We all have a story in our life. The good, the bad, the experiences, the lessons, the mistakes, we all have it. And this course, you can sort of rekindle or revise your experiences that you have faced. And that can make you to realize, okay, your achievements, how strong you are, what are the ways you can make yourself better, what are your mistakes in life, what are the lessons you have learned and gained. You know, that is what I want to make this for you all, right? So you all gave me some good answers, right? Any other barriers that you all can ways to overcome?
I mean that means that skill-based training, that practice.
Yes, Taranga, that's good. Now a good answer. Skill-based training. Yes, that's a very good answer. Thank you. Now more elaborative. Good. What about the guys? Anything that you all can tell? Janaka, Pubudu, Lahiru, what are your answers? Possible ways to overcome. සිංහලෙන් උනත් කියන්න කමක් නැහැ. Start එකේ හොඳට කතා කරා දැන් කිසිම දෙයක් නැහැ. ජීවිතේ එපා වෙලාද දැන්? What are the answers? Possible ways to overcome barriers.
We can do some researches, some kind of things and get the information.
Yes, very good. Very good. Yes, there you are. Answers are coming up. Guys,
No.
yes.
Yes. Now also like if there are less staff, we can maybe outsource, and we can outsource the work and get those done.
Very good. Outsource the work and get the right. So let's say you have a staff, you maybe, make it like maybe you can meet, okay, වැඩ කරන මිනිස්සුත් එක්ක you can have a small meeting, and then even I think that is a thing corporate sectors should understand, okay, if there are shortage of staff, even if you cannot give them a high pace, if the company doesn't have to compensate more money, do something nice for them. Maybe you give them a small gift, a packet of rice, a packet of, the human nature is a small thing can make us happy. You can see even the most wealthiest man, you give him a box of chocolate and you give him a card and say thank you, you will feel appreciated. You will remember that person for a lifetime. Not because he is expecting that, but you are making that person to feel valued. This is human nature. In my lecture, in my MSc, I had a professor when I was going through some difficult times. He was there to help me. because I had a lot of people in my batch who was very jealous of me, who tried to bring me down, but he understood the difficulties I was going through. He supported me many times. And even during my graduation, when I came to Bangkok, I always ensured that I would give him a small gift whenever I went to see him. And to this day, he really, really respects. And he's a professor, mind you, but whenever he sits or whenever I go to talk to him, he stands up for me. But I'm just a student for him because I know he feels valued. Remember that I'm telling you all is in life, you have to have these skills. That's what I'm saying. So even if there is a shortage of staff, if you cannot give a pay raise or if you cannot give more money to their work, give them something like a hamper, a family food package for them, maybe a packet of rice, noodles, and certain dry rations, that makes them feel okay, whatever I'm doing, I feel I'm rewarded in some way. This is human nature. That is why I say you have to have soft skills. And you're not bribing that person, you are making that person to feel valued. Okay, you are doing a lot even in the time when there's a shortage of staff, and as a reward you deserve this. You understand? This is what I'm trying to say. So possible ways to overcome barriers is showing them appreciation, showing them gratitude, showing them respect, or you trying to find certain technical ways of effectively how you communicate with them. Okay, so anything else, students, anything else that you can feel? Because this will be the last slides that we will do today. We are almost done with the lecture. Any possible ways to overcome barriers?
And we can train them, madam, once a year or twice a
Yes,
year.
very true. So for example, if you say that you have lack of time, then you can say when there is not enough time, step away from the day-to-day activities to additional learning, right? Observe a colleague performing a task, ask question, provide a mentorship to a new staff. That is a way you can overcome when there's a lack of time. When you have a shortage of staff, ensure an infrastructure in the place for providing opportunities, okay? Or you can increase the staff recruitment and retention. So maybe you can advertise and say, okay, there is a job offer. Or you can do something like I told them. If they are doing a lot of work, give them certain, concessions like food or something like that, or give them the free opportunity to go home with free transportation. You need to give that something so that they are valued. Okay. Lack of IT skills and resources. If you feel they lack IT skills, then you need to maybe have some workshops for them, maybe train them a little bit, teach them maybe something in PowerPoint, teach them something in Excel. You teach them and you give them that resources. Shift patterns. If everybody is working in the night time, maybe you can change and you can say, okay, you can work today, 2 days in the morning, 2 days in the night. Okay, you have a pattern shift. Lack of funding. In this type of situation, you can you can request, the company can request for funds, or you can have a fundraising project, maybe ice cream sales, something like that. Like you can do something to raise money so that you can overcome certain situations that is lacking because of money. Like if you cannot have like gloves or personal protective equipment, maybe you can raise fund, maybe car washing, maybe certain things that you can do and get the money. It's not a shameful thing. Like for example, in the school that I was teaching, children didn't have PowerPoint, multimedia. So, and no teacher was in support to do this. I wanted to teach my students in multimedia. What I told my students is, if the school is not funding, let us have our own fundraising. So we had movies, we had ice cream sale, we had acharu sale, and I had a very good support of students who supported me, and they really, to this day, they really loved me, and most of them are now in medical school and they are in engineering schools. Like they are now 18 and 19-year-olds, but to this day they are very, very respectful. They talk to me, they message me, even now they ask questions from me because they remember the impact that I made in their lives. So that's what I said, nothing in life is an excuse. You can always find a way out. Okay, you can always find a way out. Okay, right? So we are at the end of our session. Anybody has any questions, students? We spoke today about task 2, what you need to write in introduction, body and conclusion, and we studied about professional development. Any questions? You have 1 minute to ask.
is it okay to send that email
No
next
problem.
week?
No problem. No problem. Taranga, you sorry. Yeah, Taranga. Yeah, no problem. But don't ask questions that I have already repeated. My advice is go through the videos 3 weeks ago. Make sure you will read the slides and watch the recordings. And if you cannot understand anything in the question, then you can ask, but don't ask questions about whether how to do referencing. Is this correct?
Miss, I already done. I will send it.
Okay, Taranga. That I'm just not for you. I'm just telling for everybody because I asked many times today. Do you all have any questions? Do you all have any questions? And I told you all you can ask in Sinhala. You can ask anything. So because students understand, I am very, 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 very busy. To be honest, I'm very busy. I am going through a lot of my own personal things, lot of personal issues, but I am not giving any of that as an excuse to not to cut the class. If I am cutting it also, it is for a very valid reason, but make sure that I will always cover up. Now I couldn't cover the last week lesson, but you have to have that faith. It will be covered, right? So try to remember the good things that the lecturer has done before the blame goes on to the lecturer of what one thing she couldn't do. You have to have that remembrance and understanding. Okay. Already you all have a lot of work to do. So make, even if you cannot have that lecture, try to make use of that time because you already have enough and more work to do. Right. So have that understanding. To be honest, I am going through a lot, right? So with all that, I am making time for y'all. That is why I get very upset and irritated when y'all don't answer and ask at the right time. Okay, students, thank you for the session. I hope you all learned and make use of the advice and guidance and everything that I have taught you all. So anything you can always relate it, something that is not taught, you can ask me. And if I get late to respond, apologies for that. Because once I start my work on Monday, I don't know, I can reply maybe on Friday night only. Okay, maybe before the next session. That is why I gave a lot of time before the session started. Okay. Okay, students, then see you next week. Hopefully take care and have a good Sunday. Bye.
Thank you, Miss.
Thank you,
too.
ma'am.
Same to you, ma'am.
Take care. Bye. Bye.
Thank you, madam.